Hi, everyone. I'm Dr. Paul Remoliotis, Medical Officer of Health, East Ontario Health Unit, with your weekly COVID-19 update for May 11th, 2022. I'm going to start sharing my screen like usual to give you the latest data, both locally and provincially. Let's start with this slide here. Just shows you that our hospitalizations are still up a bit with the one ICU, but overall, we have trends that are going in the downward direction. So if you look at the next slide here, we can see that our overall hospitalization numbers are slightly going downwards, and we're seeing that provincially as well. I'll have another graph for you there. And about 40% of these are for COVID. These are all patients that have tested positive, not necessarily in a slide that shows us hospitalizations in our 4 hospitals for COVID. And you could see that we had a big peak here sort of last month and then going down a bit and sort of stabilizing. So that is overall going in the right direction. When we're looking at our positivity, we can also see that we're kind of flattening here, sort of a downward trend as well in the positivity. The other thing that we're looking at is outbreaks, and that, again, that's good news there. The outbreak numbers are going down. You can see very clearly we're down, we peaked at around 21. We're down to about 10 right now, and those take an average of 1 or 2 weeks to clear. So we are headed in the right direction. And then the other measure that we're doing is the wastewater COVID levels in Hawkesbury, in Cornwall, and in Castleman. And you can see here that basically we are really looking at leveling off of all these numbers, going downwards in all 3 areas. And if we're looking at the provincial sort of picture, because again, we're looking at province-wide approach, and because we're seeing now we're at the other side of the wave going downwards, and you can see here that overall provincially there has been a 7-day decrease of cases of about 45%. The deaths have gone up a bit again, but these are measures retro, so they're not really representative to date. They may represent previous deaths. And 1 death is too many. But looking at test positivity, there is a downward trend as well in terms of 13% downwards. Well, it's about the same, but if you look at it over a couple of weeks, it's gone down. But over the last, I would say 7 days has not been too much of a change, but it's stabilized. In terms of outbreaks, again, across the province, we're seeing a decrease, 46% decrease in the province, and hospitalizations, again, are down, as are ICU admissions as well. So again, that is a good picture that we're seeing. And then speaking of provincially, in terms of the wastewater signals in Ontario, again, the latest ones show the trends going downwards. As you know, this is a measure of COVID activity in the community, regardless of how many tests are done, because this is just the wastewater level. And again, if you look at it in all pockets of our population, Eastern, which for our area starts in Hastings, which is Belleville, you could see a downward trend. You could see a downward trend in Toronto and a downward trend now across the province. So that's all headed in the right direction. We're also seeing positivity trends. This is actually, let me see if I got another one here. Yeah, this is the older one. Yeah, so this one here shows us the positivity trends going downwards in the province. And again, you note as well that we're having a bit of a decrease in testing, because it signifies the number of people that are less symptomatic, which is going down. We had a question from the media a couple of days ago about our test numbers going down, and that's because overall there's been a decreased demand in tests. If we're looking at, again, cases across the province, you could see almost all health units in green here are having downward trends of their cases, which is good. And then if you look at the hospitalization rates and you compare them to our cases, and again, this is the wave 5 and this is wave 6, so you could see that our cases, went up a bit, our hospitalizations followed, and the hospitalizations are going down, and ICU levels are stabilizing and going downward slowly as well. There is a bit of a lag between cases and between hospitalizations, so we do expect this to start going downwards in the same direction as the cases go as well. In terms of vaccinations, again, our focus now is 3rd and 4th dose really in our area. You can see that now we're up to 22.5% of people 60 plus who have received their 4th dose. But we're still at 57% of the population overall that's received the 3rd dose. And if there's one thing that we can collectively do to help make this a better summer, much more normal than previous summers, is get your third dose if you're eligible. And I'll talk about that a bit later. But looking at sort of our numbers by age group, we could see that our 80 plus population has almost 45% fourth dose. Our 70 to 79 is 27.2, and then going down to 11.9. So we have work to do in these areas here. And you can see that the green, which is the third dose, is pretty good until we get down to the 50 to 59-year-old age groups. And then we can see that we're going on a downward trend here. So we need this population here, again, particularly 50 and below, including the 12 to 17s. We really need to increase that third dose level, because I showed you before, there is increased response and increased protection against hospitalization against Omicron with the third dose, and the third dose lasts longer, protects you for much longer. So that's quite important. And the other thing too that I showed you again is that people who have had who've had their third dose but get infected tend to be much less contagious. So overall, the third dose, multiple reasons for really going and getting it, and it's available everywhere in our region. So basically, you know, we've blunted it. Now we're on the downward. Vaccination is kind of the key. Get your third dose if you're eligible. Get your fourth dose if you're eligible for that. Go and get your first and second dose. We're still giving first doses and second doses. People are coming in. They're available throughout. And again, wear a mask in indoor crowded places. Again, that's going to be reevaluated over the next couple of weeks. We believe that that will be less necessary as the cases go down, but we're still having a level of transmission in our community. And then again, just to sort of, before I finish, just to sort of give you an overall kind of picture of our schools. There's no schools that are closed, and really there's very minimal. We are now have Paxlovid, and again, if you're eligible, please call your healthcare provider, go to our website, go and you'll get some information. It is available in multiple pharmacies in our area. And so this is, again, it's kind of redundant, but it's a good news. It's good news. We're going in a downward trend. We're not completely out of the woods yet. We still have, like I said, our positivity is still 13%. We'd like to see it below 4 or 5% to be able to say, yeah, we really got less transmission in the community. I think we're going to get there. And again, don't forget your public health measures. Don't forget your masking. Don't forget washing your hands. And the other thing that we're doing at the health unit, both locally and provincially, is actually looking at what the fall is going to look like. You know, what we're seeing right now, the other thing that I just wanted to add is that, you know, contrary to the last couple of years, because everybody was masking and we had all of these restrictions, we weren't seeing other respiratory viruses. We're not seeing influenza. We're not seeing the other common cold viruses, yet we are starting to see them over the last month. We've seen influenza A, we've seen other respiratory viruses, and we do expect them to be around in the fall again. So the summer will get better, but the fall will again start, you know, with increasing respiratory illness. And again, we're going to have to reevaluate our situation. Then we're preparing for that, flu shots and so on. But overall, you know, for the next, I foresee for the next couple of months, going into May, June, July, I think that's going to be a much more normal summer where you can enjoy yourselves outdoors, where the virus gets minimally transmitted, and the sun doesn't like the sun either. The UV rays tend to kill it, and so we're safe in that regard. So keep up the good work, and again, thank you for all you do to protect yourselves and our community, and for your patience. And I'll talk to you next week.